The government is once again making major changes to both Medicare and Medicaid. And today we want to go over those with you so that you can see what's happening to the benefits that you rely on. So, as you may know, the Centers for Medicare and Medicaid Services issued 9 new announcements last week alone, detailing different adjustments that they plan to make to these benefit programs. 9 announcements is a lot. Now, these include everything from really technical payment changes to what they are calling bold reforms. One in particular has implications for people with chronic conditions like heart failure or low back pain that I really think that you need to be aware of. So today we're going to be reviewing the implications for low income people who rely on these programs, whether you're, a mom, a child, a senior, a person with disabilities. I know a lot of the people who follow our channel rely on both of these programs, sometimes both of them at once. So I want to make sure that you're aware of all the things that are rolling out. So, with that in mind, let's start with Medicaid. Now, Medicaid, of course, has a lot of changes coming up from the one so-called One Big Beautiful Bill Act. Those aren't what we're talking about today. We're going to be hyper focusing on the announcements from CMS that were released because these are a little bit different. Now, CMS says that they found that 2.8 million Americans were enrolled in 2 or more health coverage programs at once in 2024. Now, this does not apply to people who are eligible for both Medicare and Medicaid at the same time. This is specifically talking about people who were enrolled in Medicaid in more than one state, or in CHIP in more than one state, or those who were enrolled in either Medicaid or CHIP and a subsidized ACA exchange plan at the same time, right? So when you see this, don't freak out if you're on both Medicare and Medicaid. That's still fine. This is referring to people who are enrolled in more than one of those other programs. Now, CMS claims that this duplicate enrollment is costing taxpayers over $14 billion a year in wasted spending. So, of course, they're going to try to cut down on that, right, to save some of that money. So, here's what they're doing. They are going to be enforcing rules that require states to examine data for dual enrollments at least twice per year. That may sound familiar because that was one of the goals of that big act that passed. However, there are a lot of states that have waivers that make it so they don't have to do that, and they're saying that those waivers are not going to be extended. Now, they are also notifying individuals who are enrolled in, either Medicaid or CHIP and a subsidized plan that they're going to have to make a decision, right? You can't have both of those things. So if they're no longer eligible for CHIP or Medicaid, they're going to be asked to unenroll in those, or their subsidy is going to be ended. And when that subsidy is ended, you'll also have the option of ending that coverage as well if you can't afford it without that subsidy in place. And a third option is if you think that this decision is made in error, that you can notify the exchange that the data match is incorrect and provide proof of that claim so that they can straighten that out for you. If you don't take any action, if you ignore this letter or you just don't know what to choose and it goes too long, they will just end that subsidy in 30 days. And it sounds like you're going to be responsible for whatever that payment would be without that subsidy, which could be a really big problem for a lot of people because those plans are not cheap. So if you get that letter, please pay attention. Don't ignore it. Make sure you take action by the deadline. Another announcement that they made talked about those shorter coverage periods. So, in the past, I think on this channel, we've talked about how different states handle their Medicaid programs differently, right? Some states have allowed adults to stay on Medicaid for up to 24 months at a time, even if their circumstances change. And especially in recent years, a lot of states have started trying to extend the period of time in which a child can be eligible. So, a child could stay on Medicaid up to age 6 in some areas. And the federal government is saying that they are going to stop approving state requests that allow that kind of behavior. They really want everyone to have to participate in those recertifications every 6 months to continue receiving those benefits. So, if your state currently has one of those waivers, once that waiver expires, I would not expect it to be renewed because they basically said they're not going to be doing that. In fact, they said that this practice leads to unsustainable expenditures, as you can see in that quote there on screen. Now, this is, of course, not the only change that they're rolling out. They're also going to be ending workforce services, which is kind of an interesting choice since they're also enabling those work requirements as well. But some states had been using Medicaid funds to pay for job training or employment programs to help people meet those work requirements. Now, CMS is saying that they will not be approving any more of those going forward. Any state that currently has a job support waiver will be allowed to finish out the term of that waiver. They're going to continue to honor those, but they will not be approving new ones, and any existing ones will expire at the end of their term. CMS does not foresee extending those for any reason. Going forward, they really want to force states to show cost savings or health benefits in order to secure that waiver and that extra funding. In addition to that, they are also going to be rolling out some new treatments for sickle cell disease. And even if you don't have sickle cell disease, I think it's really important that you understand how they're doing this because they're doing this in a way that's never been done before. This is kind of unprecedented. So they're rolling out this new cell and gene therapy to 33 states, DC, Puerto Rico, and so on, but on a kind of a contingency basis, right? They're basically telling the companies that make these medications that the treatments have to work or Medicaid's going to get their money back, which they haven't really done that before, where they demand that the therapy deliver those results or they demand the rebates back. So, as it says here, this is the first time that they've negotiated discounts based on patient outcomes. This is not the only outcome based change they are making. A little while later, we're going to talk about some new performance based changes to Medicare that they're trying to make that could have a very significant impact on people with chronic conditions. So, if you're on Medicare and you have a chronic condition, please make sure that you stay tuned for that because it's a pretty significant change. Now, in addition to this, with the sickle cell disease treatment that they're rolling out, there's the states are going to receive funding for that. There's a lot of benefits to it. Those programs can begin anytime between now and January of 2026. And if you are affected by that condition and you're wondering if it's going to be available in your area, you should be able to see the list of participating areas on screen now. Feel free to pause that if you need more time, but I'm going to go ahead and move on because I know that a lot of you are probably here for that Medicare information, which we're going to dive into now. So let's talk about the Medicare changes. Now, there's a lot of technical stuff in here, and I don't want to lose you. So I'm going to try to move fairly quickly over the things that I think you're probably going to find boring. Feel free to pause or go check out these press releases for yourself. They're all on cms.gov if you would like more information. So, one thing I noticed as I went over these is a major prioritization on quality scores. So, hospitals and surgery centers here will be able to get a small payment increase if they meet quality reporting requirements. There's a lot of other things in there about, star ratings and quality scores and things. One thing that I also noticed is that to reduce waste, Medicare will pay less for treatments done at certain hospital clinics to bring that cost more in line with local doctors' offices. And this is a big deal. I don't know if you're aware of this, but a lot of big hospital chains are buying up small doctors' clinics, things like that. I saw a release about that recently. And then they upcharge those services because now it's a hospital service and not just something that you're receiving from your local provider. So I can understand why Medicare would come in there and be like, just because you're owned by the hospital doesn't mean we're paying hospital rates. Like, we want to make sure we're paying a reasonable amount for that. So that change makes a lot of sense. Another change that I think is probably going to help a lot of people is that they're phasing out the inpatient only list. So historically, there was a list of, I think it was like 253 procedures that Medicare would only pay for if you were inpatient in the hospital getting that done. But a lot of those you don't really need to be inpatient for, right? That was just a technicality on how to get it covered. So they are going to be phasing that out over the next 3 years so that more procedures can be done outside of the hospital, which is usually cheaper for you and cheaper for Medicare, right? So everybody kind of wins in that circumstance. But that phase out is expected to last about 3 years. So it's not something that you're necessarily going to see change overnight. Now, some other changes that are being rolled out, they're making some adjustments to things that are approved to help fight the opioid crisis, making a lot of changes regarding what they call skin substitutes. And we'll talk about that in a minute because that's been an interesting development in and of itself. One thing that I really loved in here is that hospitals will now have to publicly show the real prices paid for services. It looks like they actually have to show you what people are paying and not just what they're trying to charge, and not just a vague estimate either, which can be really helpful when you're trying to determine how much a service is going to cost. I know I have a son who recently aged out of our health insurance, and trying to figure out where he should go to get certain things done, just shopping around for prices has been really, really hard. So I think this particular change is going to be really good. And it's supposed to start January 1st of 2026. So we can look forward to that. So, a lot of these changes that we're seeing are expected to save Medicare about $11 billion over the next 10 years, which is why they're making all of these different things. Now, those skin substitutes that I told you about, the reason they're cutting back on that is because it's become a major source of Medicare fraud. A couple of years ago, we started talking about how urinary catheters, like all of a sudden, all these companies were billing like billions of dollars for people who didn't need them or want them. And it was just a way for these providers to bill Medicare and get a ton of money. Skin substitutes seem to be the new replacement for that. They said that Medicare spending on skin substitutes has grown from 256 million in 2019 to over $10 billion in just a 5-year window. And in fact, CMS stopped $1 million in improper payments to a medical group practice because they were claiming that these substitutes were being used by the owner of the practice who was a psychiatrist, and that didn't really make a lot of sense. But since those substitutes can be billed as high as $2,000 per square inch, that's an easy way, I think, for a lot of those providers to kind of bulk up what they're billing for, which is why they're cracking down so hard on that particular treatment at this time. Now, some other changes that they are making will help people who have prediabetes. If this particular rule that they are currently proposing is finalized, it will make lifestyle coaching, nutrition help, and peer support free for people on Medicare who have prediabetes. And they're also changing out what they're using as quality measures. They said there was 10 of them that didn't directly improve patient health outcomes, so they're getting rid of those, and they're adding 5 more that focus on the prevention of chronic disease, which is why they're taking such a hard look at how chronic disease is handled. They're trying really hard to prevent that. That being said, I have some concerns about some of the changes that they are making. So, what I'm about to show you is a little bit technical, but it's really, really important for people who have chronic conditions, specifically low back pain and heart failure, because that's what they're targeting with this specific change that we're about to talk about next. So, CMS is proposing a new ASM payment model for people who receive specialty care due to either of those conditions. And this is a direct quote from this press release on cms.gov. Okay. It says the model aims to enhance the quality of care and reduce low value care by improving upstream chronic disease management. Participants will be held accountable for their performance, generating savings. End quote. Okay. So, what they're doing is they want to get this new rule passed that would change how these providers are paid from January of 2027 until December of 2031. And it would put them on a performance based, basically, model of reimbursement, which they're saying is going to be designed to help improve care. But I have a little bit of concern and reservation about that. I have some loved ones who have chronic low back pain issues. I've seen how a lot of providers handle that, and I'm just not convinced that this is going to work the way that CMS thinks it's going to work. So, what they're saying, and I had to dig through a whole bunch of different material and a whole bunch of different pages to find this. You'll see the screenshots of the pages that I looked at here on my slides. But they're saying under ASM, that's the name of this model, specialists who frequently treat people with original Medicare for low back pain or heart failure in the outpatient setting within a selected geographic area would be financially responsible for the outcomes of their care and incentivized to better prevent and manage these conditions. Basically, if your specialist is treating a whole bunch of people on original Medicare and they're not getting better, they're going to be financially penalized for that. And I know some conditions, like improvement, isn't necessarily forthcoming on those. So definitely have some concerns there. But they're saying that more than 2/3 of people with original Medicare live with at least one chronic condition, and their care accounts for most original Medicare costs. And they're saying that of those chronic conditions, heart failure and low back pain cost the most. So that's what they're starting to target. So the way this is going to work, and I'll try not to get into too much detail here, is they want to reduce low value care expenditures. I really hate when they use terms like that and they don't really clearly define it. So, the best I could find was that low value care expenditures means avoidable hospitalizations and unnecessary procedures. But again, who's defining what's necessary? I did see some people commenting that this was going to mean less imaging, less MRIs, more things like physical therapy, which is pretty much always, promoted as kind of a first line of defense against low back pain. I don't know. I have someone in my circle, my social circle, that has dealt with low back pain since early 20s that providers just haven't been able to treat. And it's been a fight to try to get the care that we need to even diagnose what is actually wrong here, to get the imaging done, to try to look and see what's going on. It just seems like every step of the medical pursuit there has been a fight, and so incentivizing doctors and telling them that, they're not gonna get paid if they're doing unnecessary testing and unnecessary procedures and stuff, that kinda scares me because that just means it's gonna be a harder fight. No, I'm not saying that's what's gonna happen. That's just my hypothesis based on my personal experience and the stuff that I read. Hopefully, this will actually improve care the way that they're saying it will, but if you have low back pain, if you have heart failure, and you're on original Medicare, and you think there's a chance that you're gonna be affected by this, I would encourage you to reach out to our sponsor, Chapter Medicare, and talk to them and see if you're on the best possible plan for you, or if there's a possibility that there's a different plan out there that might better suit your needs. I found out after starting to work with Chapter that there are over 20,000 Medicare plans out there, which just seems insane. um, but if you're concerned about this, I would strongly recommend that you're here. I'll throw the number up on screen for you, that you call that number and you just chat with them and see what your options are, especially if you rely on specialists and different things that, you know, anyway. Never hurts to make sure you're on the best plan, right? Because, like I said, with this new ASM model that they're rolling out for the chronic conditions on original Medicare, they're going to be basically determining your specialist's pay based on, the improvements, the amount of money that they're spending, different things like that that could potentially change how you're being treated. And like I said, that proposed rule is supposed to go into effect in January of 2027 if this rule is implemented, and it would last for 5 years until January of 2031. And for that first year in 2027, when it's implemented, the payments to your provider could be 10% higher or 10% lower than normal, depending on their performance. I didn't see anything indicating what it would be after that first year, but I would imagine it would be more extreme. They tend to start soft and then, get bigger with time as people get the hang of it. And again, this is only going to affect people on original Medicare who have chronic low back pain or heart failure. So hopefully that explains all of that. Now, that being said, there was some good news in these announcements too, right? And it's possible that that was good news and that maybe because of the experiences I've had, maybe I'm just a little more skeptical than I should be. I don't know. But there was definitely some good news in these documents. For example, they are making permanent those COVID era flexibilities that made it easier to get telehealth services and digital care access. They're talking about covering more digital tools and mental health devices starting in 2026. And if you have any thoughts, opinions, anything that you want to share with them regarding the changes that we discussed on this particular press release, there is a 60-day comment period for this proposed rule that is open until September 12th. So you can go to federalregister.gov, find the rule, comment on it, let them know what you think, let them know what your concerns are, especially if you've got a chronic condition on original Medicare. I think that making sure your voice is heard on that point is really important. And then, of course, you can also call our sponsor Chapter there at the number you see on screen if you'd like to look at your options and see if maybe there's something else that you should be doing to get maybe a different plan or better care or whatever. Now, of course, our sponsor Chapter has also given away their Amazon best-selling book on Medicare free to our low-income audience as well. You can opt into it at the link that you see on screen. I've heard some people saying that our link shortener, lirlinks.com, isn't necessarily working for them. So if you can't get that link to work, you can also go to our actual website at lowincomerelief.com. We've got a sign up bar there in the banner on every page of our website where you can easily click into that and claim your free copy of this book. It's a fantastic book. Medicare can be really, really confusing. And I feel like the way that Ari breaks it down just makes it so easy to understand. It's just so helpful. Definitely go check that out. And I will be back soon with more ways that you can save money and get free stuff. I'll see you then.